When it comes to maintaining brain health, especially as we age, the conversation often centers around diet, exercise, and managing chronic medical conditions. But recent research has uncovered a surprising and often overlooked factor that can dramatically impact stroke risk: the position in which we sleep. As a brain doctor, I've spent years counseling patients on the best ways to protect their cognitive and neurological function. I always emphasize the importance of blood pressure control, cholesterol management, and lifestyle choices. However, new findings have taken me and the medical community by surprise. The way seniors position themselves during sleep can literally raise or lower their risk of stroke overnight. The latest insights come from a groundbreaking 2025 study published by the American Heart Association. Researchers focused on obstructive sleep apnea, a condition characterized by repeated pauses in breathing during sleep, which is especially common among older adults. They discovered that sleep position plays an outsized role in the severity of sleep apnea symptoms. Specifically, individuals who sleep on their backs, known medically as the supine position, experience dramatically worse symptoms compared to those who sleep on their sides. Why is this so important? It turns out that sleep apnea doesn't just disrupt rest, it places enormous stress on the cardiovascular system. During apneic episodes, oxygen levels drop and the body responds by raising blood pressure and increasing heart rate. These changes don't just disrupt sleep, they create a perfect storm for stroke risk. Elevated blood pressure and irregular heartbeats, both common in untreated sleep apnea, are well-known triggers for stroke. The news that sleeping on your back can worsen these symptoms is both alarming and actionable. A closer look at the data deepens the concern. In a study published in the journal Sleep in 2012, researchers examined stroke patients and their sleep habits. Astonishingly, 2/3 of participants spent the entire night sleeping on their backs. Even more concerning, nearly a quarter of these individuals suffered from positional sleep apnea, a form of the disorder that is directly exacerbated by sleep posture. The severity of their strokes, measured by the National Institutes of Health Stroke Scale, correlated with the amount of time spent in the supine position. Simply put, the longer a senior slept on their back, the more severe their stroke appeared to be. For those living with stroke risk factors, high blood pressure, atrial fibrillation, diabetes, or a prior stroke, the implications are clear. While traditional advice has centered on medication and lifestyle, these studies underscore the urgent need to pay attention to something as simple as how you position yourself in bed. So, what's happening in the body when we sleep on our backs? In the supine position, gravity causes the tongue and soft tissues of the throat to relax backward, narrowing the airway and making it more likely to collapse. This effect is pronounced in patients with sleep apnea, leading to more frequent interruptions in breathing. Each episode of apnea triggers a burst of stress hormones, spikes blood pressure, and disrupts the heart's rhythm. Over time, these nightly assaults can damage blood vessels in the brain, setting the stage for a stroke. Side sleeping, in contrast, helps keep the airway open. The tongue and throat tissues are less likely to slide backward and block breathing. Studies have shown that simply switching to a side sleeping position can reduce the severity and frequency of apneic episodes. For seniors, this is more than a matter of comfort. It's a potentially life-saving intervention. In response to these revelations, healthcare professionals are now taking a proactive approach. Sleep position is being discussed in clinics and hospitals alongside blood pressure checks and medication reviews. For seniors especially, this represents a new frontier in stroke prevention. What can you do to protect yourself or a loved one? The answer starts with awareness. If you or someone in your family tends to sleep on their back, consider making a conscious effort to switch to side sleeping. This can be easier said than done, especially for those who have spent years in the same sleeping position. Fortunately, there are simple strategies that can help. One effective method is positional therapy. Devices such as specialized pillows or wearable belts can gently encourage side sleeping by making it uncomfortable to roll onto your back during the night. Even placing a tennis ball in the back of your pajamas can serve as a reminder to stay on your side. Adjusting your sleep environment, choosing a supportive mattress and pillows, can also make side sleeping more comfortable. For those already diagnosed with sleep apnea, continuous positive airway pressure, CPAP therapy, remains the gold standard. However, studies now suggest that combined strategies, using CPAP and promoting side sleeping, can provide even greater protection against stroke. The implications extend beyond sleep apnea. As we age, changes in muscle tone and anatomy make us more susceptible to airway collapse during sleep, even if we haven't been formally diagnosed with apnea. Chronic snoring, restless sleep, or unexplained daytime fatigue can all be warning signs that your sleep position may be contributing to poor nighttime breathing and increased stroke risk. It's also important to remember that sleep position is only one piece of the puzzle. Maintaining a healthy weight, managing chronic medical conditions, and staying active all play vital roles in reducing the risk of stroke. But the research is clear. Ignoring sleep position, especially for seniors and those with sleep apnea, can be a costly mistake. For many, this information comes as a shock. The simple act of rolling onto your side could be as important as taking medication, exercising, or watching your diet. In fact, for those with untreated sleep apnea, sleeping on your back may be the single most dangerous thing you do each night. Public health campaigns are beginning to recognize the significance of sleep position in stroke prevention. Senior centers, sleep clinics, and physicians' offices are now incorporating sleep posture advice into their educational materials and consultations. The hope is that by raising awareness, more seniors will take proactive steps to protect their brain health. In summary, the latest research leaves little room for doubt. Sleeping on your back can dramatically increase the severity of sleep apnea, which in turn raises blood pressure, disturbs the heart's rhythm, and sets the stage for stroke, especially in seniors. By adopting side sleeping, using positional therapy devices, and discussing sleep habits with your healthcare team, you can significantly lower your risk. Let this be a wake-up call. Stroke prevention isn't just about what you do during the day. It's about how you position yourself at night. Sometimes the most powerful interventions are the simplest. Tonight, as you prepare for bed, remember, the position you choose could make all the difference for your brain and your future health.